Barbara Clumpy, who worked very hard on that for many years. We enjoyed working together. And something just as simple as that. The unfortunate part that I think it took a young man dying actually in a high school here in Little Rock to really bring the type of attention that we needed to really get that done. But we were able to accomplish that. Right now, all school campuses are required to have automatic external defibrillator on campus, and just last week we were able, with the legislators' help, to be able to fund, provide funding for some of those areas, like Senator Crumley was talking about, that cannot afford these very important life-saving devices. We're able to provide now some financial resources, financial support. Kudos to those school districts who've gone ahead, like the Little Rock School District, and purchased those defibrillators on their own. I'm sure most of you saw the story about the young man's life who was saved because Parkview, the same place where the young man passed, Dr. Rose, in your neighborhood, that young man was saved because right there behind the bench during the basketball game, there was one of these devices. So those type of public policy issues that you have an opportunity to be a part of that can save lives is critically important. But often I'm asked, what's the number one? And you can't really place them in an order. But I tell you, the most difficult piece of legislation I've had to deal with was the Clean Indoor Air Act. You know, I am especially proud of us working together to push that forward, because not only is that saving lives, but it sends a message about how serious the state of Arkansas is about health care. You can imagine just a few years ago and all the grief that we got, Tom and Joe, and all of the criticism that we received. I remember leaving the Capitol as moderator after we got it out of committee, and I was on my way to lunch and listening to one of the talk radio shows. And a man came on a talk radio show and he said, "Nobody's gonna tell me where to smoke, and if I ever see this Tracy Steele in person, I'm gonna give him what for." But
is that what he said? What for?
Yes, that's what it was radio, public radio. So but you know, when you go to other states, go to Mississippi and go to a restaurant, and you're really reminded how ridiculous a smoking section really was. It was really ridiculous. There's no such thing as a smoking section when you're under the same roof. So that is really helping to save lives. And there's been many other things that we've been proud to be a part of, and it's because of the leadership that we have in this state, and because we have worked together in coalitions and groups to be able to move Arkansas forward.
Thank you very much, Senator Steele. And let's give a hand to all of our panelists, because that's as far as we can go with our discussion. Thank you very much. And I want to say thanks to each of you out there for taking your time to be here as well, because I know there are many more advocates in the audience. Dr. Ron, I will ask you to come to the stage now, but this is Dr. Daniel Ron, who is our new chancellor since November. And, you know, somebody said, of course, they're not endings, they're just beginnings. And we got us quite a peach all the way from Georgia. So they are a peachless -1 down there. But Dr. Ron has shown a tremendous sensitivity to this issue. And he has really demonstrated that he has a vision for Arkansas being one medical Arkansas and not have these disparities that continue to go on and on. So though he's been here only since November, I've been heartened to see that he really sees his state for what it can be and not just mired in just what it is, and we just sit there and gripe and complain about what it is, but a man who is moving us forward. forward. And I appreciate your being here and making closing comments. And now my apology to you, because I was supposed to be somewhere 15 minutes ago. So my mama did teach me manners. When you see me walk out when you're talking, I do know better. Thank you, and thank all of you.
Thank you, Senator Elliott, and thank you, panelists, and all of you who are here this evening. This is very interesting for me. I have been here for 4 months, actually. This is March 1st, right? I started on November 1st. So I'm beginning my 5th month, and I've learned a tremendous amount during the time that I've been here. One of the things that I've learned is that this is a state that really cares about itself. I'm really impressed with that people here care about Arkansas and Arkansans, and I think that's something to really build on. And I think this discussion this evening is really great and reflects the diversity of talent and effort that is being committed to the issue of societal health. The issue, of course, is whether the needle can be moved and can be moved successively. We know what the issues are. Probably everyone in this room knows what the issues are. It kind of doesn't matter exactly how you look at it, but factors kind of add up. Rural geography, low educational attainment, poverty, minority status. You add them together, and what you end up with is an excess burden of ill health. And it doesn't really matter that much what index you look at, whether it's oral health, teenage pregnancy, low birth weight babies, cancer mortality, participation in known effective cancer screening, be it colonoscopy or mammography, cardiovascular disease and mortality, obesity-related illnesses, HIV infection, trauma, risky sexual behavior. They all add up, and they add up to an excess burden of ill health that affects quality of life. It in turn affects educational attainment, which was part of the problem to begin with, and it affects economic productivity, which was part of the problem to begin with. So you get in this cycle. That just kind of goes on and on and on. And the issue is how we can convert that cycle into a virtuous cycle and begins to reverse that trend. And some of the things that were mentioned here this evening involve things like a tobacco tax, a public policy decision. The measuring and distribution to families of body mass index as an index and a predictor of poor health among school-age children, and the effect that seems to be having on the trend of obesity in school-age children.